has been my very objective. I know that, like in my case as a nurse, I've always wanted to help, but in some other ways, being a teacher and doing this, informing you all of this opportunity. Today, I'm going to show you how to assess a peak expiratory flow rate, or commonly known as Peakflow meter reading. So we have here a patient, Andy Smith, who is not a non-asthmatic but has been having breathing issues. The patient is in the outpatient department. The doctor has requested a Peakflow test to assess lung function, and there are no medications to do. Complete the Peakflow and document on the charts provided. Let me just begin this station with the 7 steps of hand hygiene. I've already washed my hands with soap and water a while ago. Let me just carry on with this procedure using hand rub. Palm to palm, back of my hands, fingers interlaced, fingers interlocked, rotational rubbing of the thumb, fingertips, wrists, and let my hands dry. Now let me just first wear a visibly clean apron. I have here a tray that's already been cleaned with soap and water for the past 24 hours and still haven't been disinfected. Let me just wear my gloves first from a box that's dry, intact, and in date. I have here clinical wipes from a packet that's dry, intact, and in date. I'll clean the tray from farthest to nearest using an S motion, including the sides, as well as the bottom, and I'll allow it to dry. Let me just throw this to the clinical waste. Do my hand rub. Of course, we need a hand rub, and we also need a Peakflow meter. This Peakflow meter should be dry and clean, should be intact with no cracks, and the gauge is freely moving. This should also be single patient use, and it should be used within 1 year. We also need a disposable mouthpiece. So, to begin, we need to assemble the equipment. We need to attach the mouthpiece to the Peakflow meter. And we're ready. We can now go back to the patient. Assuming that privacy and scene safety have been ensured, identity and allergies have been checked, pain and comfort have been addressed, procedure has been explained to the patient, and the consent has been taken, I'm now happy to go back to the patient. Hi Andy, I'm back. I already have the materials for us to perform your Peakflow meter reading. Are you still happy for us to proceed with that?
Yes.
Alright. So Andy, I'd just like to know, have you tried this before?
No.
Okay, so it's your first time. Don't worry, I'll give you the full instructions so you know how to properly do it, okay?
Mm-hmm.
But just to set your expectations, we need to take 3 readings. And if there is 40 liters difference on each of the reading, we might need to do 2 further readings. Alright?
Mm-hmm.
I know that this can be quite exhausting, so don't worry about that. We have the crash trolley readily available, as well as the ox machine and the oxygen, just in case we need it. Okay?
Mm-hmm.
But don't worry, if you feel like it's already very exhausting and you need some rest, just take some rest and let me know if you wish to continue, alright? Okay. Now, Andy, I just also like to remind you that since this will be your first time, it would be nice that you keep track of your readings. You can keep a diary of your best and current reading so that we can compare, because basically this test is to assess your lung function and capacity, so we can also continuously check your progress. All right?
Okay.
Okay. So let me just give you the instructions. So this is the Peakflow meter, and then this is the mouthpiece. In this case, we have to ensure that the gauge is freely moving and it is set to 0. Now, I just need for you to, you can actually do this sitting or standing up. Which do you prefer?
I'm good sitting.
Alright, now if that is the case, just keep both of your feet flat on the floor, sit upright, and just allow your neck to be in a neutral position. Sorry. Now I need for you to hold the Peakflow meter horizontally, and then I just need for you to breathe normally. And in full inspiration, I need for you to grasp the mouthpiece with your teeth, seal it with your lips, and in a short, sharp puff, I need for you to blow as forcefully as you can. Alright?
Mm-hmm.
Are my instructions clear?
Yes.
Alright, so let me know if you're ready to do it.
I'm ready.
Alright, so this will be your Peakflow meter. The gauge is freely moving, it's set back to 0. So I just need for you to maintain a good posture, keep your feet flat on the floor, sit upright, and your neck in neutral position. Hold the Peakflow meter horizontally. And then I need for you to just breathe normally. And upon full inspiration, I need for you to grasp the mouthpiece with your teeth, seal it with your lips, and in a short, sharp puff, I need for you to blow as forcefully as you can. And then I will check on the reading. So the first reading for Andy is 550. I'll just take note of that. So 550. While I take note of this, Andy, you can take some rest. Just let me know when you're ready.
I'm ready.
All right. So it's going to be the same thing. We're just going to do it thrice. So this is the second round. I just need for you to just sit upright and then keep your feet flat on the floor, your neck in a neutral position. Hold the Peakflow meter horizontally, and then making sure you don't impede the gauge. It should be freely moving. It's set back to 0, and don't impede the holes as well. I need for you to breathe normally, and then in full inspiration, I need for you to grasp the mouthpiece with your teeth, seal it with your lips, and in a short, sharp puff, I need for you to blow as forcefully as you can. All right?
Mm-hmm.
Okay, done? The next reading is, the second reading is 540. Let me just take note of that. So Andy, at this period, I'd just like for you to take some rest. And let me know when you're ready.
I'm ready.
All right. So this will now be the final reading, hopefully, if there's no difference of 40 liters or more. All right. So the gauge is now set back to 0. It's freely moving. I need for you to sit upright, feet flat on the floor, neck in a neutral position, hold the Peakflow meter horizontally, and then I need for you to make sure that you don't impede the gauge as well as the holes. Breathe normally. In full inspiration, I need for you to grasp the mouthpiece with your teeth, seal it with your lips, and in a short, sharp puff, I need for you to blow as forcefully as you can. The third reading is 550. So the first reading is 550, second is 540, third is 550. Andy, you can take some rest. So as we can see, the best and the current reading, which will be the final reading, is 550. I'll just write that down. I'll just reconfirm information from you, Andy. I can see here that your age is 60 years old and the height is 167 centimeters. Is that correct?
Yes.
Okay, so both information are correct. And my patient is a male patient. I'll just have to compare and check the normal values for Andy. So since his age is So I'll just have to confirm and double check the normal values for Andy. So since his age is 60 and he is a male patient, his height is 167 centimeters. So we just have to check what would be the normal value for him. So the normal value for Andy is 550. So the final reading we have for Andy is 550. So I will now tell Andy about the results. So Andy, we've already gathered the results. The normal values for you for your peak flow meter reading should be 550 liters per minute. Now in your case, in this exercise we did, you actually scored 550 liters per minute. So you are within the range of your normal values. Alright, so I will let the doctor know about this so that he can look into your treatment regimen. Okay? But for now, how are you feeling?
I'm okay.
That's good. If you think that you feel anything, just let me know, alright? Meanwhile, I'll just have to make sure I'll clear out, and I'll make sure that the disposable mouthpiece will be thrown to the clinical waste bin, and then this peak flow meter is cleaned and it's stored appropriately in the patient's cupboard. And then this tray is also cleaned, ready for the next use. It is thrown in front, the clinical waste bin. So Andy, I already have written in your notes the reading you have for your peak flow meter reading. And is there anything else that you need from me?
No, I'm okay.
Alright, if that is the case, if in case you need anything, here's the call bell. Press the orange button, I or my colleague will come to help you. Alright?
Okay.
Alright, thank you so much for your cooperation, Andy, and I'll see you next time. I'll just end this station with the 7 steps of hand hygiene. 1, 2, 3, 4, 5, 6, 7, and let my hands dry.